Welcome to this AJR Insider video. I'm Andy Rosenkrantz, Editor-in-Chief of AJR, and I'm here today with Dr. McKinley Glover, a radiologist in the Neuro and Emergency sections at Massachusetts General Hospital and an employee of Optum United Health Group. Additionally, he serves as editor of the journal's Policy, Quality, and Practice Management section. In this video, he'll be sharing with us his insights about the area. McKinley, thanks for joining us.
Thanks, Andy, for having me.
Can you tell us about your background in policy, quality, and practice management?
Sure, happy to. Over the last probably 20 years or so, I've had a number of experiences that have aligned with my interest and passion in these areas. Uh, it really started as soon as I graduated college. I moved to Baltimore and was doing health disparities research and became really interested in health policy and particularly how the healthcare system influenced access to and quality of care. And so that led me to go to the Johns Hopkins School of Public Health, where I earned a master's in healthcare finance and management. And there was an amazing opportunity to be with some of the leading experts in public policy as it relates to healthcare, and really got a really strong foundation in the overall US healthcare system, including policy, financing, legislative, and other areas. And so that's really what accelerated my path towards this area. And since that time, I've had a number of experiences, a number of leadership roles within the American College of Radiology, including serving as a Rutherford Fellow, where I spent some time with our legislative advocacy arms. I've also served on the board of the Massachusetts Medical Society and was heavily involved in the American Medical Association as well, getting a unique perspective on organized medicine and how that influenced policy as well. And also at Mass General, I was a fellow in health policy and management for the Mass General Physicians Organization, where I led a number of initiatives related to population health management and multi-specialty practice management. So I've been pretty fortunate to have a pretty diverse set of experiences within policy, practice, and quality.
Let's move on now to the journal section. What do you see as areas of priority for publishing in policy and quality over the coming year?
Yeah, great question, Andy. I'm really excited about the topics that are becoming increasingly important for our section. So naturally, one of the hot and continually increasingly important areas is artificial intelligence, large language models, et cetera. This is an area that is rapidly accelerating within the clinical and non-clinical realm. And what this means for our clinical practice, as well as the influence on the larger healthcare ecosystem as it relates to financing, liability, patient outcomes, and health disparities, is increasingly important. So this is one area that we will continue to prioritize as it relates to articles that are particularly clinically relevant or meaningful to our practicing radiologists and our broader readership. The second area I would say is workforce. I think it's no surprise to many radiologists on the ground that increasing volumes are something that everyone is facing, and the radiologist shortage as it relates to kind of increasing clinical demands is something that we will continue to prioritize, particularly in the realm of how our practice is managing these challenges in kind of clinically relevant and practical ways to support our radiologists and patients. And then the third area I would highlight is around value-based care and population health. Within the larger healthcare ecosystem, the shift towards value-based care and away from fee-for-service will continue to be a dominant theme. And how do radiologists engage in these models, which may require fundamental changes to the way we are reimbursed and or practice? It's something that we want to make sure we stay on the cutting edge of.
Are there tips that you have for authors who are looking to publish in this section?
Absolutely, Andy. I think as someone who's written a number of manuscripts myself, any sort of tips are much appreciated. So, from our perspective, I think the first thing is just being very clear on the article type and guidelines that the journal has and making sure that you're really aligned to that. Just following those details will save you and the editorial staff a fair amount of time. The second thing is, I would say, over-indexing on a really strong and compelling introduction, meaning clearly setting the stage for why this work is meaningful, and what really differentiates the research questions or hypotheses from previous work that may have already been done in the area. And then the third is around the discussion. One tip is really pushing authors to go beyond recapitulating what was in the results and really striving to come up with insights and recommendations and perspectives that are going to continue to advance the field and the relevant research question.
Any other common pitfalls that you are seeing in submission?
There are a few, I'd say, common pitfalls or themes we've been seeing recently. I think one is, I would say, a few. So the first would be kind of insufficient background research. We find this either as editors or through sending out to our reviewers. Sometimes there are some gaps in some of the seminal literature that may, one, obviate the need for the manuscript, or show some gaps in kind of the knowledge to inform the particular research questions that are being asked. The second is a little bit more broad around kind of, I would say, disorganized manuscripts. So I think, to the extent that being really structured in the manuscript and the research questions and the discussions and the method particularly is something that's helpful, particularly to our reviewers, as they're trying to really give their perspectives on, if the manuscript will be something that should be published within the journal. A common, I'd say, pitfall or theme we've also seen recently is single institution studies, which we do welcome if they're particularly novel, but we're really encouraging our authors to think about, multi-institutional research opportunities, or potentially using large databases. Or if you are going to pursue single institution studies, really look for kind of unique or compelling insights that haven't been done before.
We started our editorial roles with AJR in 2020 during the height of the COVID-19 pandemic. And at that time, we were getting a lot of submissions on the pandemic's impact on radiology practice. Since then, as we've gone past the pandemic, what shifts or changes are you seeing in the major topics for submission?
Yes, obviously the COVID pandemic, there was, and rightfully so, a high proportion of our submissions that were related to the pandemic. I think since that time, we are still seeing some post-COVID manuscripts that are looking to see what the long-term effects are in terms of practice, quality, outcomes, et cetera. I think the biggest shift we've seen really has largely followed AI and LLMs, with a mix of articles looking at things such as evaluating particular models that can actually be put into practice, as well as how radiologists and practices evaluate AI and LLMs. So I'd say that's one big shift that we have seen. And then I would say the second has really been around workforce. In my career as a radiologist, it's been pretty interesting to see how, the job cycle in terms of, even 10 years ago, there was probably considered an overabundance of radiologists. And now we've really swung to the other side with no short-term kind of solution in sight in terms of managing the increasing demand. So that I would say that's probably the second biggest kind of pivot we've seen recently.
Anything else that you'd like for our listeners to know?
So a couple of things. I think first is we really do value and appreciate authors taking the time to submit to the journal. We realize the process can be arduous, and the work that goes into it. So first, just our gratitude and appreciation for that. I think the second thing is just reinforcing that our goal is to bring the highest quality, clinically relevant manuscripts and ultimately articles to our readership. And so, even if the ultimate manuscript is not kind of moved on for further consideration, we hope that you find that the reviews and insights are helpful in continuing to shape that manuscript potentially for other journals.
McKinley, thanks so much for joining us.
Thanks, Andy. Thanks for having me.